Please welcome Stephen Bradley, President, Massachusetts Public Health Association.
Good afternoon. My name is Stephen Bradley, and I'm proud to serve as the president of the Massachusetts Public Health Association. I'm also vice president of external relations at Bay State Health. Last year recognized as one of the top 15 health systems for quality and cost in the United States. On behalf of the Mass Public Health Association's Board of Directors, the Mass Public Health Association staff, and the people of the Commonwealth of Massachusetts, I welcome you to the great city of Boston. We are thrilled that the American Public Health Association is here in Massachusetts this year. And I'm from Western Massachusetts, from Springfield, Mass. And on your way out, why don't you swing by one of the best cities in the Commonwealth of Massachusetts. We are eager to learn from you, our national partners, and our colleagues from other states to hear about your success and challenges, your victories, and your insights. Having this kind of opportunity to meet and hear from so many of our colleagues is an inspiring and humbling experience. It inspires us to work harder, tackle even bigger challenges, and gain new ideas and new wisdom in our efforts to build a healthier and more equitable Commonwealth. And we are eager to share with you all that we are proud of in Massachusetts. Massachusetts, as you know, is a historic state. Boston is home to the first Public Health Board. Paul Revere served as its first president in 1799. The Mass Public Health Association is the oldest state health association in the United States of America, founded in 1879. We are the first state to achieve near universal health coverage for all of our residents. Give it up. We are the first state to establish a dedicated prevention and wellness trust fund. Through the efforts that began in the back room of the Mass Public Health Association in its Public Policy Committee, which was led by one of the outstanding public policy leaders in Massachusetts, Mattie Ribble. But perhaps most importantly, the Boston Red Sox are the first team to win 3 World Series in this decade. We invite you to get to know us at the Mass Public Health Association. Please visit our expo booth over the next few days, and please join us Monday evening when we will be hosting a reception here in room 158 at 6:30 p.m., where we'll be celebrating our victories over the last year, as well as honoring Mayor Menino and Massachusetts Senate President Therese Murray for their years of service to the Commonwealth and their tremendous public health accomplishments. That's Monday evening at 6:30 here in room 158. You know, we extend the definition at Bay State Health. We extend the definition of health to include economic opportunity, affordable housing, safe neighborhoods, quality education, food security, arts and culture, and racism and homophobia-free communities. All elements needed for individuals, families, and communities to thrive. I point that out because that's not your traditional definition of acute care, is it? But it sounds a lot like the definition of public health to me, which is where we're going with healthcare reform in Massachusetts, with an emphasis on education and wellness. We should all understand that we, those of us in this room and across the country, cannot fix our broken cities or our dysfunctional school systems. We cannot successfully reduce crime or teenage pregnancy or drug and alcohol addiction or heal our sick bodies or tormented minds and broken hearts unless those of us, white folks like me, who have benefited from 400 years of racism, accept responsibility for undoing and healing racism personally, but even more importantly, institutionally, because it is through our institutions that we perpetuate racism. And if we want to cut the cost of health care in this country, all we need to do is attack the social determinants of health. If in fact 25% of the cost of the health care in this country is caused by racism, as I heard when this convention was held in Philadelphia a number of years ago, that is $800 billion a year that we can reduce costs by simply by giving people of color the same services, the same access to care, and addressing the social determinants of health that oppress them. We should leave this convention understanding that of all the great diseases that we wish to conquer, there is no disease more insidious to the American population than the disease of institutional racism. And I challenge each of us, our state public health associations, our governments at the state, federal level, to make undoing and healing racism the top priority of public health and healthcare in general. I hope over the next few days I'll have the opportunity to meet many of you and establish new connections and relationships for the future. And with those comments, I'm extraordinarily pleased today to introduce the Massachusetts Secretary of Health and Human Services, John Polanowicz, who serves in the cabinet of our great and honorable Governor, Deval Patrick. John is an experienced healthcare leader and is using his expertise in health to help Massachusetts residents increase our already national leading access to care, while also tackling the issues of cost. John's compassion and thoughtfulness make him a strong advocate for our veterans, families, and individuals with disabilities across the Commonwealth. Prior to his appointment as Secretary of Health and Human Services, Secretary Polanowicz served as the president of the prestigious St. Elizabeth's Medical Center in Brighton, Massachusetts, overseeing the largest hospital in the Steward healthcare system. He brings expertise working in a cutting-edge community healthcare system, serving tens of thousands of patients and their families. He was also instrumental in positioning Steward as an accountable care organization to increase access and decrease costs for patients and small businesses. Ladies and gentlemen, it is my honor, privilege, and pleasure to introduce my friend, Secretary John Polanowicz. Thank you.
Well, good afternoon, everyone. So excited to be here. I have to just take a quick picture first because my daughter is playing rugby at Boston College this afternoon, and she said the only thing that would get me out of being at the game is if I was speaking to 10,000 people. So So you folks have to back me up. So first off, thanks to Steve for welcoming to the 141st Public Health Association annual meeting here in Boston. Thanks again for that kind introduction. We are thrilled to host again the APHA and its many public health care leaders. It's an honor for me to be here amongst such a distinguished and diverse group of professionals and share some of what we're doing here in the Commonwealth to enhance the health and wellness of all of our residents. As you know, it's a great time to be here, and not just because, and you may have heard this already this morning, the Red Sox are the World Series champions. Healthcare reform and innovation is seen here at its very best, and our public health department is keeping our Commonwealth healthier than ever. Of the 15 agencies overseen by the Massachusetts Executive Office of Health and Human Services that help serve and improve the lives of residents every day here in the Commonwealth, the Massachusetts Department of Public Health is by far the most diverse. We have a very rich public health history, which dates back to the 1700s, and a legacy of innovation that stretches today. Steve talked about our history. Less well known is that Paul Revere, at the young age of 62, so there's still time, in 1796 became the first president of the Boston Board of Health, which was the first in then our only 20-year-old nation. He was a smart man. He understood that freedom of people is only worthwhile if the residents are healthy enough to enjoy it. For those of you that may have some extra time, you can learn all about our robust public health history, from smallpox to soda, at the Mass Public Health Museum in Tewksbury, which is offering special hours and free admission to all APHA conference attendees. Now, fast forwarding a century or so, we're still leading the way. It was recently announced that scientists at the DPH's Hinton State Laboratory Institute have identified a new strain of influenza which attributed to the development of the 2013-14 influenza vaccine, one of 4 strains included. The Hinton Lab is the first state lab in the nation to successfully identify a new strain for the CDC, which named the strain Influenza B, Massachusetts 2, 2012-like virus, in recognition of the finding, which I know rolls right off your tongue. We have efforts in place to increase vaccine availability at chain pharmacies while building robust partnerships with all of our local public health agencies, all 351 of them in these cities and towns here across the Commonwealth. Healthcare providers and public health nurses help us promote vaccinations. DPH has also targeted specific outreach efforts towards underserved populations using the new Flu Vaccine for Everyone outreach tool to engage diverse communities to help them learn about the importance of flu vaccination. And as a result, we have the highest rate of influenza vaccinations in the nation overall, and in the nation leading in nearly all age breakdowns. Vaccinations are up in every age group, and racial and ethnic disparities are down. Less known is our public health work tracking and preparing for the health effects associated with climate change. In the past year, we've seen the pattern of Eastern equine encephalitis and West Nile virus change significantly. This summer brought both Triple E and West Nile virus to areas that have historically had no presence of the virus, where there was only isolated areas of significant risk. We also saw the climate change this summer on shellfish as a result of historically warmer air and water temperatures. Human cases of Vibrio bacteria quadrupled, and for the first time in our history, we were forced to shut down some of our most well-known oyster beds on the South Shore and at Martha's Vineyard. Luckily for all of you, the beds are back open and oysters are safe to consume. So during your stay, feel free to enjoy some of the Commonwealth's edible treasures and certainly help us support our local businesses. Our Commonwealth's latest public health achievement is the first of its kind Prevention and Wellness Trust Fund. Last July, the Patrick administration worked in partnership with the Massachusetts State Legislature to establish a nearly $60 million grant program to reduce healthcare costs by preventing specific chronic conditions in local communities, focusing on tobacco use, pediatric asthma, hypertension, and falls prevention in older adults. Will fund community-based partnerships of clinical teams, community health centers, and municipalities that have come together to provide evidence-based interventions. The goal is to reduce rates of these prevalent and preventable health conditions, increase healthy behaviors, increase the adoption of workplace wellness and health management programs, and address those health disparities that Steve mentioned. We're also working closely with our business community with our wellness tax credit incentive that gives small businesses of 200 or fewer workers up to 25% of the cost of implementing a certified wellness program for their employees that promote healthy lifestyle changes such as weight loss and smoking cessation. In doing so, we believe we are reducing chronically preventable diseases while ultimately saving money on medical costs. In this Commonwealth, you simply cannot live, work, or play without seeing signs of us promoting public health. Even our own Boston Red Sox often stepped up to the plate for public health and partnered with us over the years to raise awareness of the significant health risks of smoking and the benefits of having health care coverage. Our Commonwealth's public health success is due in large part to our success in implementing health care reform. Our dynamic team at DPH, led by Cheryl Bartlett, who I asked to become our state's first registered nurse DPH commissioner. Our partnerships with providers and our progress in removing barriers to wellness and increasing preventative services. Here in Massachusetts, we are creating and improving these programs because we believe, as I'm sure each and every one of you do, that it is our generational responsibility to leave our Commonwealth healthier, clearer, and more accessible for everyone in the future. Thank you again for allowing us to host this incredible conference. The extraordinary array of poster sessions, panel discussions, and keynotes available to you will cover innovations, cutting-edge approaches, and new ways to view all of the issues facing us together. Thank you, and have a tremendous conference.